two factors, either the presence or absence of oxygen and the presence or absence of the metabolites from this tissue. So let's say this is the tissue. We'll make a tissue cell over here. Let's say this is a tissue cell. This tissue cell is receiving oxygen which is coming into this blood vessel, and it is producing waste products, carbon dioxide and other waste products. Okay, now the metabolic theory says that as the oxygen reduces in a tissue that is functioning, that reduction of oxygen will cause the relaxation of the blood vessel and would increase the flow to that area. So let's see how does that happen. Look, let's say this hand is working and the muscles here are consuming oxygen right now, and they are producing metabolites that are the waste products. The oxygen lack or unavailability of oxygen part of this theory means this: when the oxygen comes into the blood vessel and the tissue is contracting and working, that oxygen will be pulled away. This oxygen will be pulled to the tissue very quickly. Now that means this oxygen will not be available as much as it should be for the endothelial cells and the smooth muscle cells that are working within the blood vessel. So what that means is blood vessel itself will not get oxygen and the tissue has pulled the oxygen away. Lack of oxygen in the smooth muscle will cause what? Remember, oxygen is helpful in aerobic metabolism to produce the ATP. So that means low oxygen will mean low ATP. ATP is needed to, number one, convert to activate this tropomyosins to move the troponin thread away, and ATP is needed here for the active heads to work, for the myosin heads to work. So when there is less ATP, this is a direct lack of oxygen. When there is less ATP in the muscle cell, that would mean that this binding and power strokes will not occur and the muscle would relax. So that is the lack of oxygen causing the relaxation. And where did the oxygen go? Go to the tissue. Now, second factor, another lack of oxygen, but indirectly. The second factor is lack of oxygen will cause the tissue to produce metabolites. What metabolites are we talking about? The tissue will be producing adenosine, hydrogen ions, potassium ions, prostaglandins, prostacyclins, etc. So these metabolites that are being produced, their amount of production will increase when oxygen is less. Now, why will that increase? Look, there is some common amount of oxygen coming to this tissue. All of a sudden, tissue started working. The demand increased, but oxygen supply has not yet increased. The flow has not yet increased. So all of a sudden, the tissue started producing these metabolites in greater number. That is one possibility. The other possibility is that somehow the tissue was not doing anything more than normally what it should be doing, but the blood supply got reduced or oxygen got reduced. How would that happen? Let's do that. Let's say I occluded the blood supply, or let's say I went to a higher altitude. So how will you reduce the oxygen? Go to higher altitude, have carbon monoxide poisoning, have cyanide poisoning, have problem with the hemoglobin, block the blood vessels that are bringing the oxygen, cause pneumonia that would cause the oxygen and carbon dioxide exchange problem. So all of those reasons and many more will ultimately cause reduction in oxygen. So either reduce the oxygen here or increase the oxygen demand. The result will be that when oxygen need is less and tissue is still working, tissue would start producing metabolites. These metabolites in turn would cause relaxation. So let's see how would they do the relaxation. Let's talk about one of them.